As you may know, yeah, Asian Pacific area actually is an area with growing economics, and of course, it has the greatest populations in the world. But I think in the past decade, actually, as you may know, Asia also has a varieties in socio-economic status, and most importantly, they have diversities in healthcare system. You may have some countries with full national health insurance coverage, such as Taiwan, Japan, and Korea and Australia. But you also have other countries that with increased income, but the healthcare cannot cover almost the high-cost medicine, such as CAR-T bispecific antibodies. So in Asian Pacific, I think we have a different requirement and the needs for this novel medication that we want to know how to utilize all these novel medication in our daily care. And in the past, I think in Asian Pacific area, we are accustomed to go to the Western countries for great hematology conferences, such as ASH, EHA, and the SOHO. But it only limited to the leading physicians in every countries. And for the young staff, it is very hard for them to get support to go to ASH annually, or to go to SOHO or go to EHA. So I think for this reason, I and several of my colleagues actually, when we met the leading physicians in SOHO, we found that it is a great opportunity because I think SOHO is quite different from the ASH and the EHA. For ASH and the EHA, I think they are mainly new clinical trial was announced, but it is not so educational for the conference. So we are trying to introduce this concept to our leadership in the Hematology Society of Taiwan. And finally, we decided that we can host a SOHO Asian conference here. Because this is the first conference for SOHO Asia, we decided to host the SOHO Asian 2026 in June. So it has only 6 months or less to prepare for the conference. But actually, finally, in these days, I'm very happy to see that quite a lot of physicians, not only from Taiwan, but also we all invited the colleagues from Thailand, from Malaysia, from Singapore, Hong Kong, Japan, Korea, Australia, and also even India. Most of colleagues from international regions, especially from the South Asian countries, they said that they are very impressive with the conferences because we can have so many top experts here to have education and to have opinion exchanges about the treatment in the hematology disease. So I think I'm very proud to have this opportunity to host this, the first SOHO Asia in 2026 in Taiwan. Yeah. In Asian Pacific area, the most important question, maybe I might have two. The first is that although we know many of the novel drugs actually has a promising result in treating hematological disease, the socio-economic or the healthcare system actually delayed the introduction of this kind of medicine in our daily practice. So I think we must do more to know or to encourage our government to improve the investment in healthcare. That will be very important. And the second is that actually we have quite a distinct biological issues in hematological disease. For example, the T-cell lymphoma actually is quite an important question in this area, but the clinical studies and the research regarding this Asian Pacific specific disease actually is lacking. So in this conference, I think I am also encouraging the discussion between AP expert and the Western expert about how can we facilitate the research and how can we utilize novel drug in this kind of AP specific disease. I think the Hematology Society of Taiwan HHE is advanced cancer cares and in the hematological malignancies. In the future, I think we are continue trying to improve the care qualities in Taiwan for hematological disease, but also we are going to engaging more with the other society. Especially, I think we have established a good connection with Japan, with Korea, and with Australia. And in the future, I think we are trying to get a collaboration with Thailand, with Singapore, with Malaysia, with Hong Kong, and India. It was very important for us to have a regional specific care pattern.